Okay, today we're going to set the 6 anterior, maxillary anterior teeth for a wax try-in. We've got the occlusion rims as formed and presented by the dentist in the office, and in it they've recorded incisal length, how long the teeth are going to be, lip support, how far facial the teeth are going to be, and the midline. Okay, those are the 3 pieces of information that are recorded here. They may or may not have used a Fox plane and recorded the occlusal plane here. If they did, we need to know that. Otherwise, the guideline is 2/3 of the way up the retromolar pad. But for now, we're just going to set the 6 anteriors. And we need to maintain that information. There's 2 ways to do this. One, we could just take and remove a little bit of wax and set our denture tooth on there to this incisal length and lip support area and midline. Or we can transfer that information to the lower rim, which is what I'm going to do, which allows you to grind on the base plate. If there's not room to set the teeth and you have to grind on the denture base underneath it, then with wax on it, it's hard to do that. So I'm going to add wax to the lower to make it flush with the upper to record that information. So I'm just going to take a little piece of wax and add it on here like that. And I'll transfer the midline to it like that. And now it's at the same incisal length, it's at the same facial profile, and we've got our midline. So now I can remove this wax from canine to canine until I get down to a bare base plate, so that if we need to grind on it, which is pretty common and frequent that we have to do that, we can not be sacrificing and grinding on the denture teeth. So this information can go because we've transferred it to the lower. That's the most important part. If you haven't done that, you can't take this off. Now I can go back on here, see how much room we have to set the teeth. And in this case, I've got enough room that I don't have to do any grinding. Okay, but that's about where that tooth is going to go. All right. So now I'm going to put just enough wax on to hold those denture teeth in place, because if there's a key to setting teeth, it's to set in as little wax as possible, which is the opposite of trying to work around that big wax rim that's in the way and hard to melt all the way through and makes it hard to move the teeth. Now, these anterior teeth are going to go right off the crest of the ridge. So I'm going to put enough wax on there just to hold the teeth, and I'm going to do the 4 incisors. And the canine, I may have to remove a little bit more wax here. We'll see when I get that far. So I want to loop this down so it's not going to move. And I'm going to soften it up a little bit. Okay, like that. And I'm going to take my first central incisor, place it off the crest of the ridge, and set it to the information that was recorded chair side. Now the cervical should be in from the incisal edge. Okay, we're going to line it up on the midline. The tooth should look like it's coming from off the ridge, not out of the vestibule. All right, just about like that. It's going to form an arch form, okay, that's recorded here, that's also symmetrical with the ridge. Sometimes you'll have an ovoid ridge, sometimes you'll have a square ridge, sometimes it'll be tapering. This one is ovoid, so the distal of the central is going to be rotated a little bit to give us that round arch form. If it's a very tapering form, then the central is going to sit more angled back, like that. If it's a real square ridge, then the central incisal edges will be more like that. Okay. This one we're going to ovoid and go around the ridge. I'm going to set the other central next so that I make sure that we're lining up the midline properly. So long axis straight up and down, midline lined up with the line, incisal edge so that they're out the same amount of lip support and the incisal length. And they should mirror one another. Cervicals are in, incisal edge is out. That's pretty much where I want them. I'm going to go on to the laterals. If you're having trouble keeping this base plate down, you can wax it down so that it's not coming loose, being hard to work with. Now the laterals should follow the contour of the centrals, except the incisal edge should be raised about 1 millimeter. In the neck, so the cervical areas should be just slightly more depressed. And it should follow our arch support, our arch form for the lip support, following that fairly ovoid dimension. Now as we're doing this, we want to be as symmetrical as we can from one side to the next, from the patient's left to the patient's right. And that's where this True Bite ruler can come in. Okay. It's marked, if you look at it, it's got a median marked on here. That red line should go down the middle of the palate, and you can look at where the incisal edge is in relation to the ruler. Now it does not necessarily going to be in this arch form exactly, because you might have a larger patient or a smaller one, but the distance the teeth are from that should be symmetrical from one side to the next, so that'll help you. Or the bottom of it will be perpendicular to the midline area. So I'm going to go ahead and set the next lateral. Same as the other side, the incisal edge is going to be raised up about 1 millimeter, long axis, parallel to the centrals, fairly straight up and down with the 4 incisors. Once you get it in place, you can add a little bit of wax and lute it down. If you've got a small amount of wax there, it'll allow you to move it. If you're setting into a big block of cold wax, then it's hard to adjust. Okay, so our 4 incisors are going to look just about like that. Next, I'm going to go to the canines, and the canines are set a little differently because their angulation is more sets up the buccal corridor. It's got a prominent cervical, and it's kind of the corner between the anterior and the posterior teeth. It should be back on the plane, on the occlusal plane, not raised up 1 millimeter. You can have a slight distal inclination, but not a lot. And the cervical should be more prominent. Okay, so just about like that. Okay, from here we can put the occlusal plane on it and see if we're on that plane. So the centrals should be on the plane, the canine should be on, the lateral should be slightly off. And with the prominent cervical of the canine, okay, that's going to set up the way our posteriors go. The cusp ridge of the canine, the distal cusp ridge, should be pointing down the buccal corridor. I'll go ahead and set number 6, and then we'll should be done with the maxillary anteriors. The festooning we'll do after the teeth are set. We want the Cusp tip of the canine on the plane, lateral slightly off, prominent cervical, cusp ridge pointing down the arch. Once you get it in position, add a little bit of good hot wax to seal it down. So it should look like that.